Hello, I'm Dr. Robert LaLouche, a board-certified OB/GYN physician with over 30 years of clinical experience. Today we're going to talk about the post-operative course or after surgery for a hysteroscopy, with or without an ablation. So a hysteroscopy is a surgery where we put a tiny fiber optic scope through the cervix and look inside of the uterus. There's no cutting on the belly unless you have an additional surgery like potentially getting your tubes tied. And it's relatively brief. Sometimes we do an ablation. If you have polyps or fibroids, we have to take those out. So let's cover the most common reason for this is heavy bleeding or regular bleeding. So let's say if you have heavy or regular bleeding or potentially have postmenopausal bleeding, that's bleeding after menopause, then we would look inside, we would see if there is something inside the lining of the uterus that shouldn't be there, like a polyp or a fibroid or thickened lining, and we usually do a D&C, we may or may not, which is just dilating the cervix and scraping out the lining of the uterus. The majority of these cases are very short and have a very easy and simple recovery. The risks are very low. Usually after recovery, there's mild discomfort to no discomfort. You might feel like you're on your period. You may have some bleeding. Sometimes that bleeding is a couple of days, sometimes it's a couple of weeks. It depends on what exactly you have. And what you want to watch for afterwards is, first of all, that it's a decreasing amount, that it's not to a dangerous amount, and it should be less than the original bleeding, which may have brought you to the surgery in the first place. Obviously, if you're concerned that something is happening that is far out of the range that you've been told, then you certainly should contact your provider. There is a small chance of infection. If you get an infection, you might get a fever, some cramping. That's worse than expected. So watch for fevers. Anything above 100.5, we generally recommend that you call your provider. You may or may not get some prescription medicines. Generally, a non-steroidal anti-inflammatory is the primary medicine for this, like Advil, ibuprofen, naproxen. Some of those are given, sometimes Toradol, that can be given to you when you're at the hospital. And generally, we see you in follow-up for 4 to 6 weeks. The specimens are sent to pathology, and that might come back, depending on where you are, in say 3 to 10 days. And generally, your provider will give you an inkling of what to expect from that. But you always have the option of contacting your provider within that time range to get alerted. Generally, in my practice, when I get the normal result back, I have the nurse give a call and say everything is fine. We'll go over it when we see you at the post-op follow-up, which for me on the average is 4 weeks, but it might be anywhere from 1 to 6 weeks depending on your particular clinical issue and the style of your physician. Very simple, quick surgery, but can solve problems. We do this pretty frequently, and over my 30 years of experience, I've never had any patient with any dramatic problem, and the vast majority of the time it resolves the problem that they went in there for in the first place. So I hope you found these comments of use. Please leave your own comments, and we appreciate the feedback. Thank you.